Hello everyone, this is Dr. Clark from the Center for Hormone Health and Wellness in Newport News, Virginia. Thank you for taking some time out and thank you for your interest in hormone pellet therapy to optimize hormones to optimize your health. That's what we want to talk about and really try to figure out, is it right for you? So I'm going to go through what's involved, the pros and cons, and kind of talk to you a little bit about, is this something that you should consider? All right, so let's get started. Subcutaneous hormone pellets have been around for a long period of time, and what we've come to find out is that very likely this is probably the best way to optimize both testosterone and estrogen, some of the two most important hormones that we can do to improve health, improve well-being, and just kind of get people to live in that healthiest state. So that's where we're going with all this. We're going to talk some about this in much more detail. Well, let's back way up. Hormones. What does that really mean? You probably hear this term all the time, but what does that mean? What is a hormone? Hormones are basically chemical messengers, and they communicate between one part of the body and another. So they're sending messages then. But only the tissues that have the receptors to that hormone will actually respond to that hormone. It's kind of that lock and key mechanism, that the hormone is the key. It has to fit into this lock very well in order to unlock it then. So you have to have that really good fit there. So but hormones are really just chemical messengers. That's really a key point I'd like to make. And they're one of the main tools your body uses to maintain homeostasis, or what I refer to as balance, hormone balance. And we like that balance to be optimal. So hormone balance is a key concept. If you've listened to any of my discussions through Center for Weight Loss Success, I bring this topic up over and over because there are lots of different hormones in the body. Estrogen, testosterone are just two of them. They're the sex hormones, but also thyroid hormone, insulin. We talk about some of these hormones all the time. We'd like to get them in their best level to give you your best health. So balance is absolutely key here. I'll come back to that concept over and over. Now, when we talk about estrogen and testosterone, we're basically talking about the sex hormones. All sex hormones are derived from cholesterol, and there are really three sex hormones: testosterone, progesterone, and then estrogen. And estrogen, human estrogen, there are three types: estrone, which we refer to as E1, estradiol, which we refer to as E2, and then estriol, which is E3. Estradiol is the most important one, and that's the one that that you're affected most by, with how you feel, with are you getting hot flashes. This is the one that affects that the most. And how well you are sleeping, lots of different little symptoms that it can affect. So we'll talk a little bit more about all of these, but estradiol and testosterone are the ones that we're really going to be talking about as far as pertaining to hormone and pellet therapy. Now, men and women share all these hormones. Often we think of, this testosterone is a man's hormone, progesterone and estrogen is a woman's hormone. But all humans, men and women, have these hormones. And the only difference is just the absolute and relative amounts of them, the ratios of them, and the exact total amounts too. And they make us male and female, but they affect a lot of different things too. So hormones are important for everybody, and hormones get out of whack, they can wreak hormone havoc. And very likely you have experienced some of these sensations and emotions. So why do we talk about hormones, and how should this really help you? Well, hormone balance, again, I want to go back to that concept. We want to be fully present, active, and productive each day. Now, in our work life, in business, we often talk about absenteeism. So, if you're not feeling well, you have to you stay home. But what about that presenteeism? Presenteeism is really, okay, I'm there, but I'm not really fully present. I'm not really very productive because I'm not thinking clearly. I just don't feel that great. I'm tired. tired, I'm fatigued, I don't sleep well at night. And this will affect all kinds of different things in our life, financially, emotionally, physically, spiritually. So if we can get this balance correct, or improve it, or optimize it, it's going to improve all of these things. So how do you feel? We don't want you feeling like this. All right, so HRT, what does that mean? Hormone Replacement Therapy. That's the shorthand version for it. Hormone Replacement Therapy facts. Okay, every day about 3,500 women enter into menopause. That's every single day. Symptoms of menopause can begin up to 15 years earlier. So it's not like all of a sudden you wake up and, hey, I'm in menopause. It's like, no, these symptoms tend to sneak up on you. Women often know the very familiar ones, such as hot flashes, tired, not sleeping well, and all those are really common, and people often know those, but there are lots of other symptoms too. Now, male hypogonadism, or sometimes we refer to it as maleopause or andropause, is present in about 40% of males over 45 years old. And again, this isn't something all of a sudden you wake up with. It's very slow. Is that because these hormone levels have kind of slowly, drifted down over years and years. Men will lose, and women, will lose up about 3% of their testosterone production per year after age 35. Women can actually start losing the testosterone production even earlier than that, especially if they've had earlier pregnancies. So, when we start talking about hormone optimization, one concept that is also very important is thinking about levels. We talk about hormone levels. Normal versus optimal. Normal and optimal are completely different things. Normal just means that you fall within 95%, or you're in the 95 out of the 100 people that fall in a certain range. So typically there's a bell-shaped curve that goes along with normal, but even if you're at the very low end of normal, you're still called normal. Okay? Now, optimal is something different. It's like, okay, we want to be at the right end. I don't want to say the upper end, because on certain hormones you may actually want to be on the low end, which is optimal. Okay? But specifically with testosterone and estrogen, typically you want to be on the higher end. You want to be in the optimal range. It's kind of go, yes, we can go through school and we can get D's and we pass. But hopefully we were at that A level. Wouldn't we all like to live at an A level? Okay? And we want to be in the optimal range, not just the normal range. Now, not all hormone therapies are created equally, because there are certainly lots of different ways to get hormones. The best ways have your body make it. Okay, but over time, if our body doesn't make it very efficiently, then we can try different ways of actually then replacing it. So hormone replacement therapy, there's lots of different ways to do it, which we'll talk a little bit more about in a minute. But there are better ways to do it too. So hormone replacement therapy is not a one-size-fits-all approach. One, we want to figure out the best way to get you the hormones, as well as the best doses of those as well. And we have ways now that we can figure this out and get you optimal doses. Estrogen. Let's talk some about estrogen. Okay, this is the primary female hormone. Both the ovaries, but also your adrenal glands, produce estrogen. Okay, so often people think, or women often think, gee, it's only my ovaries making this. But no, actually your adrenal glands do too. Estrogen has about 400 different functions on many different tissues. So it's not just affecting the sex hormones and uterus, and just there are lots of other functions that it has, and it affects many different tissues. Estrogen receptors are widely distributed throughout the body. The brain, the breast, bones, but blood vessels, reproductive organs. So it will affect a lot of different things. Brain, breast, bones, some of the most important ones there. Estrogens are also critical for sexual maturation. So puberty and reproductive cycle, absolutely. But once you've gotten through that maturation process and you're going on towards menopause, then okay, things start to change a little bit. Now, adult women make three primary estrogens. Again, estradiol, that's E2, that's the most important one. Estrone is much less important, and it can actually be potentially can make people gain weight, so we'd like to keep that one to a minimum. Estriol is made in very small amounts. It's very important during pregnancy. Okay, but estradiol, okay, is kind of one of the hormones that is more important for the overall health. So when we talk about replacement, we're usually talking about estradiol. Again, 400 functions in your body. It basically helps control hot flashes. It maintains bone density, which is extremely important as we age, as all people age, but especially as women age, you want to maintain bone density because osteoporosis is incredibly common. Helps maintain memory. And obviously, we don't want to be forgetful as we get older. We don't want to have that early dementia. It reduces the risk of certain cancers, colon cancer specifically. It maintains collagen in your skin to keep that younger, healthy skin. It increases serotonin and dopamine, which are very important in just how you feel. These are our natural antidepressant type of molecules in our body, and it increases them. Now, a couple things will decrease your estrogen. That's smoking and stress. So smokers and very high stress people may get a decline in their estrogen earlier in life than other people would. Progesterone, we're going to just spend a minute here. Progesterone is kind of the natural antagonist or the balancer of estrogen. Again, balance is key. Progesterone balances the estrogen during the female cycle. So it's kind of the yin and the yang of the female hormone system. Now, the relative balance here either determines a state of physical and emotional well-being or unpleasant symptoms. Now, progesterone can drift off very early. I mean, literally in late 20s, women will sometimes have progesterone drifting off much sooner than estrogen may drift off. And because of that, you'll sometimes hear that concept of estrogen dominance. And it's because progesterone levels have drifted off, and that can actually produce some of those symptoms that women get around menopause. So progesterone, again, is produced mainly by the ovaries, but also by the brain and the adrenal glands. Receptors are found in the brain, the breast, the blood vessels, bone, the reproductive organs. Again, so many tissues are affected by progesterone. Low progesterone levels, women will have higher risk for fibroids, endometriosis, and potentially uterine cancer. So that, I guess, part of an important point about that is that if you have a uterus in place and you are going to receive estrogen treatments or estrogen therapy, hormone replacement therapy, you should also get progesterone replacement therapy because it will protect you then from uterine cancer. Decrease that risk. All right, testosterone, again, a very important hormone, not only for males, but also for women. Now, in males, it's made by the testicles. But in women, it's also, again, made by the adrenal glands and the ovaries. Okay, so and women make about 10% of the amount of testosterone that men make, but it's critical, absolutely critical for sex drive, heart health, as well as preserving bone mass, muscle mass. Again, you don't want to get osteoporosis. You don't want to get muscle wasting. You want to keep your muscle mass. That's what keeps your metabolism higher. And it also just gives you that sense of well-being. So it's a very important hormone even for women. And women often don't understand that. So for most women, we talk about hormone replacement. We really want to talk about testosterone replacement too. It's just much smaller doses than we give men. Testosterone in women is going to fall by about 50% from between age 20 and 40. So it starts drifting off fairly early in that. And it usually has to do with around pregnancies. The earlier you had pregnancies, very likely the earlier this is going to drop down. And one of the reasons that is that it's kind of nature's family planning, because testosterone has a lot to do with your libido. And so subsequently, if you've had a number of pregnancies, and so subsequently then kind of the natural kind of that family planning part of this whole thing is going to be, well, testosterone levels drop. You tend to have less libido and therefore less likely to get pregnant. So there is something to that, but you don't want testosterone levels to get way low. Testosterone can be converted to estrogen in fat cells. So women that have more fatty tissue can actually make more estrogen, okay, so they're less likely to get actually low estrogen, but they also tend to make more estrone, and estrone was that estrogen we don't necessarily want a lot of because it actually makes you gain even more weight, which I'll go into a few more minutes here in a little bit more detail. Testosterone, again, is the brain hormone. It helps provide major symptom relief by protecting not just the brain, though, but the bones, the breasts, the heart, your joints, as well as, yes, relationships. Okay. Men, again, age 37, they lose about 1 to 3% of their total testosterone every year. Now, that doesn't take many years to really add up to a significant amount of loss there. Women lose, again, 50% of their testosterone production between 20 and 40. And absolutely, this is a take-home point, women make and need testosterone. Lots of different symptoms. And this is symptoms that are very common with low testosterone, low estrogen, low thyroid. So all these things mix up. It's just the thyroid isn't one we use as pellet therapy, but it is a very important hormone to optimize as well, which we'll talk about when you come in to see me and you get your lab work done, because we will check these things. But some of the symptoms really common. You probably recognize most of them. Tiredness, just the mood swings, higher tension, poor sleep habits, that memory loss. I can't remember why I walked in this room, where I put my car keys. These are these little things start to add up over time. Decreased sex drive, depression, hot flashes, night sweats, weight gain, joint pain, often related to hormones drifting way off, migraines, just severe headaches, just that fatigue. I hit the wall at 3 to 4 o'clock. And for men, less of erectile ability. Men typically, let's throw this out there, typically that is one of the last things that they lose. So even when testosterone levels are dropping down, they'll usually still keep their sex drive. They'll usually still keep erectile ability. Although at some point, it's going to drop way off too. So, sound familiar with all these things? Really common symptoms. All right, I do want to take a minute to talk about bioidentical versus synthetic hormones. Now, you may have heard lots of things out there about hormones and how, gee, if you have hormone replacement, how bad estrogen might be, how bad testosterone might be. And the reason is a lot of the studies that were not done with bioidentical hormones. They were done with synthetic hormones. Now, I have a picture of progesterone here in the top of the slide, and then what is a synthetic progesterone, often referred to as progestins, okay, on the lower part of the slide. And you'll notice in the red on that right side there's a little side thing on there. It has some extra little carbon molecules, oxygen molecules, hydrogen molecules, and subsequently it's these changes that make it a synthetic hormone. We talked earlier about the lock and key mechanism. Bioidentical hormones look exactly like human hormones. And if they look exactly like human hormones, they typically don't have the high risk other bad problems, which is a synthetic hormones do. Many of the studies done out there were done on Premarin, which is estrogen made from horse urine, Premarin, pregnant mare urine, okay, as well as Prempro, which was Premarin and progestin, not progesterone, progestin. And both of those are synthetic. They're man-made hormones. They are not bioidentical. And subsequently then they caused a lot of other problems from, we'll talk more about, but blood clots, heart problems, an increased cancer risk, which we don't see in bioidentical hormones. Bioidentical looks exactly the way your body makes it, so it fits perfectly. You don't get all the side effects with them. Now, when I talk about optimizing hormones too, I do want to we're not referring to making you superhuman or super physiologic. We don't want hormone levels way up too high. We're looking for optimal levels. They're still in normal range. We just want them on the right end of normal. Is that to be on the upper end of normal typically you are going to feel better. We are not trying to make them super physiologic. It's like, no, that's where we start getting more side effects then. You want to keep them in the normal range, just optimal range. Now, hormone replacement therapy can be done lots of different ways. Now, synthetic hormones, and synthetic hormones are typically made by the drug companies. And just a little sidebar here, I'll digress again for a minute, is that in order for a drug company to patent a medication, it can't be bioidentical. Because something that looks identical to what humans make, a drug company can't go out and say, well, I'm going to patent that then. No, they actually have to change it. And that's, again, where all the side effects and problems come in, is because they changed it. It's no longer bioidentical. So when we say synthetic, it basically means it's not bioidentical. And synthetic hormones can be given lots of different ways. There can be pills, there can be patches, there can be injected ones, and bioidentical hormones can be given different ways too. Pills, patches, they can be injected, they can be used as creams or gels, and then actually pellets. And pellets is kind of where we're going though with all of these at some point, because the other modes of transmission, modes of replacement, typically tend to have some problems with them. All right, conventional hormone replacement therapy, there have been a number of big studies through the 80s and 90s into the early 2000s. The Women's Health Initiative was a very long-term study, and this was with hormone replacement therapy with Prempro, which is Premarin, that's made from pregnant mare's urine, and progestin, which is not progesterone. So they use synthetic hormones, and subsequently they did see 41% increase in stroke, 29% increase in heart attacks, 26% increase in breast cancer, twice the rate of blood clots, 76% increase in Alzheimer's, dementia, lots of bad things. And after this got publicized in the early 2000s, many women then basically stopped taking all hormones, and they really had very poor hormone balance, and symptoms were driving many of them literally bananas. Okay? Sadly, there actually has been safe alternative methods for lots of years. It's just that it doesn't get the media hype because, again, drug companies can't patent them and subsequently make a tremendous amount of money off them. So they're bioidentical hormones, though. All right. Pills, okay, hormones given in pills, there are some potential problems. This doesn't matter we're talking about synthetic or bioidentical. And it's because once we give something a pill, it has to be digested and absorbed through the intestinal tract. And once something's absorbed in the intestinal tract, the first place it goes is through the liver. So it has this first pass through the liver. And the liver is very efficient at breaking it down into its other products. And so in order to get hormone levels decently high, you actually have to take very big doses of it. And the liver then changes it basically starts to break down that hormone itself, and it's those breakdown products that tend to cause other problems. So which cause some of the high risks of vascular problems, strokes, blood clots, increased breast cancer. It's because they actually stimulate the breast tissue a lot more. You have to take this every single day. You'd sometimes get other side effects, vaginal bleeding, blood clots, headaches. So there are certain side effects of taking it as a pill form. So lots of different side effects. We're just going to throw out a few more. Breast tenderness, increased risk of endometrial cancer, which is uterine cancer, as well as breast cancer, vaginal bleeding, headaches, nausea, vomiting, fluid retention, blood clots, leg cramps, gallstones. The list kind of goes on. And again, this is with oral and pill form estrogen treatments. So then, okay, let's try patches. Okay, patches been around for a while as well. Estradiol levels, we find you can get better dosing in there. You don't have to take a monster dose that the liver is going to break down. You can get better dosing, so estradiol levels were better than the pills. But the problem here is that it's absorbed very erratically. So wherever it's placed on you, that skin may absorb it well or poorly. And many people absorb it very poorly. It needs to be changed frequently. We also note some weight gain with the patches, a little less fluid retention than with both the pills or the horse estrogen. But again, about 45% of people do not absorb the hormone well through the skin. And it tends to still give you big peaks and valleys, that roller coaster ride of symptoms sometimes. Creams and gels. Okay, so not a patch, but actually, okay, let's get a cream or gel and rub it into the skin. So there's some dosing problems here. Is that, okay, did you get the exact amount you needed? You've got to do it every day. You often have to rotate where you're doing it. There's a very short half-life. You may have to do it twice daily. It's applied topically into the skin, and then you've got to wait to get dressed. If you've ever used this stuff, and the smell on it isn't the most attractive thing either. And you can also transfer it then to other people or pets. So babies, pets, your other loved ones, that if you rub against them, it can actually transfer it to them as well. They often use estriol on this, and estriol doesn't really protect the bone and the heart and the brain as well as estradiol does. So there's some problems with creams and gels then too. Now another cream, okay, is just testosterone cream. Testin was one of them out there, and you'll see advertising for testosterone cream all the time. Okay, literally, if you turn on the TV, you're going to see these advertisements out there. Now, it can be absorbed. Again, you have erratic absorption with it. And what we find specifically, and this was a study done with men, and what the study is showing is that way on the left side, that blue bar, this is where men started it, and they have low testosterone. 250 is a pretty low level for a man in testosterone. It is definitely low, no matter what age group we're talking about. So kind of they use this cream, they usually use Testim 50 milligrams or 100 milligrams. They could bump that up, and at least it got up into the normal range, which is good, fairly erratically. But one of the potential problems there is that a lot of the symptoms don't actually go away until you get into that 800, 900, 1,000 range. An optimal range for men in testosterone is generally about 800 to 1,100. That's where where men typically feel their best and have their best risk reduction with that as well. So yeah, it was a step in the right direction, but it's really not that great as far as kind of providing you with the hormone replacement that one needs. Injectables, okay, yeah, you can actually go and get shots of, or you can actually, sometimes people will do it themselves. Really uneven absorption, and you do get this significant roller coaster effect because you'll go really high and then over a couple days it's going to drift back down. It is a synthetic injection. It's not necessarily true bioidentical, and there can be some potential adverse effects. Liver toxicity, you do see a little higher risk of coronary disease, prostate cancer. So there are some risk with just injection, and that's typically an intramuscular injection. Anabolic steroids, which is not really bioidentical testosterone, is not truly an anabolic steroid. It's often thrown into that. Anabolic steroids mean that it can't be broken down into the some of these other breakdown products, and subsequently then that can be very dangerous. You want testosterone to break down naturally the way it should, and it cannot be what's called aromatized, and therefore is potentially very dangerous. It can elevate the LDL, decrease the HDL. LDL is the bad cholesterol, HDL is the good cholesterol, so you don't want to do those things. So injectable testosterone, there are some real potential problems, and typically it's going to wear off before the next injection, and men tend to get pretty cranky when that happens. Which brings us then to pellets. Basically probably the best way to provide both estrogen and testosterone. They're actually made, they're bioidentical, but they are actually made from yams. Okay? But they look exactly like human testosterone and estrogen. So, and by giving them a pellet formula, they're not actually dissolved. It's not that it dissolved. What they do is they're slowly absorbed. Slightly different thing there. And if they're slowly absorbed, you're getting a constant kind of slow absorption of this. So levels, we can get them at the right levels fairly quickly. As well, it usually takes a good 3 to 7 days to get the notice that, hey, they're starting to kick in a little bit. And then they tend to stay pretty level for an extended period of time. For women, it'll often last 3 to 4 months. For men, they'll often last 4 to 6 months. But it gives you that steady state of hormones with no roller coaster, and they're bioidentical. Now, typically you may get little water retention initially, but that usually goes away quickly, so there's typically not weight gain with these. They're also very safe, relatively hassle-free. It does take a little minor procedure. We have to place the pellet itself, which takes about 3 minutes to do. And we can individualize the dose then. So we can get you the right dose, which will give you the right levels in a nice steady state, but it'll last much longer, literally months. So pellets are developed a long time ago. So it's not like this is something new that just came up. But this the company that we work with, this BioTe company, has been around. The physicians there have been doing this for the last 30 years and have over 30,000 patients they've worked with. But pellets were used a long time, back in the 1930s, for women that had radical hysterectomies. Either that typically was for a cancer, they'd remove their ovaries and uterus, and subsequently then we'd use pellets to kind of replace some of the hormones. So it's widely used in Europe and Australia, not so much in the United States. So what is this BioTe pellet therapy? It basically helps your body return to normal hormone balance and physiologic state. It gives you the right kind of hormone, in bioidentical, in the right amounts, because we can individualize the dosing, and the right delivery system. And so you tend to get those nice steady states over an extended period of time. And this is just a comparison of kind of what pills versus patches versus implants. When you get the implant is kicked in, you have this nice steady state. And it's really dependent on blood. As blood flows kind of near this subcutaneous pellet, is that it slowly is absorbed. And so you get this nice steady state there, as opposed to the pill form or patch form, which doesn't work nearly as well. Now, the pellet studies with bioidentical pellets, there's no increase in thrombotic or blood clots, so we don't see that either with heart problems then or with just forming blood clots. It reduces cardiovascular risk compared to the oral therapy and does not increase the risk of breast cancer. So let's go through a little bit of these studies, talk about some of these other problems you hear about that are potentially concerning. Osteoporosis. Testosterone is the bone builder. Literally, and pellet therapy is the best way to get it. Testosterone in pellet therapy can increase bone formation 8.3% per year. So if you've got first you don't want to get osteoporosis, but if you do, we can increase bone building better than any other thing, better than taking calcium, better than taking some of these newer forms of like Boniva that could give you, actually makes brittle bone out there. Yes, it'll make bone, but it's not quality bone there. So testosterone is the bone builder. Now, a very large study, the Nurses' Health Study, over 121,000 nurses, what they did is give them conjugated estrogens. Again, this was not bioidentical. These are the Premarin and Prempro, okay, which is the estrogen and progestin. Okay, they were not bioidentical. They did increase the risk of breast cancer. Now, estrogen plus testosterone, we don't see, there is no increased risk of breast cancer. And actually there's starting to be some evidence that women that have breast cancer, if they have if we replace their testosterone, they actually have a decreased risk of recurrence, and they've actually shown some shrinking of breast tumors with testosterone therapy. Interesting. Yeah, that stuff's really new out there. Now, oral synthetic methyl testosterone. Now that's not bioidentical. Actually showed an increased risk of breast cancer. So you'll sometimes see that, oh, testosterone can increase your risk of breast cancer. Well, not bioidentical and not pellet form, but an oral form of methyl testosterone can. Okay. The non-oral testosterone prevents the stimulation of breast tissue and lowers the risk of breast cancer. Again, another study that just shows that. So when you take, there are literally hundreds of studies out there on breast cancer, and this is very important obviously to women. Testosterone delivered by pellet implants does not increase the risk of breast cancer, unlike the oral synthetic methyl testosterone. Testosterone implants have shown less stimulation of breast tissue, and the treatment with testosterone and estradiol implants does not increase the risk of breast cancer, even in breast cancer survivors. Now, that doesn't mean that if you've had breast cancer that I would recommend that you actually do have estradiol pellets as well. We typically would not recommend that just because of that potential out there, but it's actually not shown with these pellet formulas to increase the risk. All right, dementia, Alzheimer's dementia. Okay, very common. It seems to be getting more and more common. One of the reasons is that testosterone levels drop. Now, just women overall get Alzheimer's disease 8-to-1 over men. Women on testosterone are 50% less likely to develop Alzheimer's disease. Men with low testosterone develop Alzheimer's disease 3 times as fast. So they're more likely if they have very low testosterone. So testosterone helps prevent Alzheimer's dementia. Now, heart disease, again, another really common problem. So does this, we'd like to make sure that this isn't a problem for you. Would it increase the risk? About 1 in 7 premenopausal women die of heart disease. In postmenopausal women, that number rises to 1 in 3. Some of that is because, their hormone levels dropped way off. Testosterone as well as the estrogen. So it can actually help prevent heart problems as well. Arthritis, again, it kind of goes along with that bone discussion we had earlier, but 10% of women, 18% of women 60 or older have osteoarthritis. It'll be the 4th leading cause of disability by 2020. Now, the cells in the joints are actually still there. The chondrogenic, which is cartilage, the chondrogenic progenitor cells, which then they turn into cartilage. They're present in the arthritic tissue. The issue is they don't have a stimulus to actually make more cartilage. So both estrogen and testosterone can stimulate these cells, and we often see arthritis pain melt away. Prostate studies, near and dear to men, obviously. And there's a question out there, could testosterone implant or pellet therapy actually increase prostatic problems? Okay. So, lots of studies out there. High levels of circulating testosterone are not associated with increased prostate cancer risk. Blood levels of androgens, which is testosterone, are not related to the risk of developing prostate cancer. So lots of studies actually showing this more and more frequently, that they're not related. And then even in a study that was done on very high-risk men, these men actually had prostatic problems. They had prostatic intraepithelial neoplasia. So that is a very high risk of developing prostate cancer. What they found is when they, even with testosterone replacement therapy, they did not have an increase in PSA, which is then a sign of kind of potential prostatic cancer. So they did not actually have an increased risk. And these were men that were extremely high risk to begin with. Alright, something near and dear to my heart I have to throw in here: sex hormones and weight. The major ways that sex hormones affect weight is by their influence on a critical enzyme used in fat storage, as well as you want to preserve lean body mass that keeps your metabolism higher. The enzyme for fat storage is lipoprotein lipase. Lipoprotein lipase is kind of the gatekeeper for fat accumulation, is that you want to keep your lipoprotein lipase levels kind of turned way down on fatty tissue so that you're not storing fat. So any cell that uses fatty acids for fuel, such as muscle, or stores fatty acids, such as fat, they use this LPL to make this possible. The more LPL activity on the cell type, the more fatty acids that can be absorbed by that cell. Now, if your muscle cells are burning it, that's great. But if it's just your fat cells absorbing it, they're just storing it. And that's not so great, because you'll be gaining weight. So sex hormones and weight, what is that? What are we talking about here? Now, the major hormone with weight is actually insulin. And insulin is the regulator of this lipoprotein lipase. And just for some curiosity's sake, in fat cells, insulin increases LPL activity, so it makes you store fat. So insulin makes you store fat. In muscle cells, insulin decreases LPL activity. So in muscle cells, the fat that's in there, it'll actually then be used, but it won't actually store more fat. Women have a higher LPL activity in their adipose tissue. So what does that mean? It's easier for women to gain weight than it is for men. You probably knew that, I imagine, but there's a scientific reason. In men, LPL activity is much higher in their abdominal region. What does that mean? That means that in men, they typically gain weight in their abdomen, but in women, it's usually higher in the hips and buttocks, which means they tend to gain more weight in the hips and buttocks. Okay, this is somewhat very individual dependent, but it's very real, and that's why women often have the kind of more weight around their hips and buttocks, men around their abdomen. And it's this LPL activity. But sex hormones also influence LPL activity. Testosterone suppresses LPL activity in the abdomen. So when men have high testosterone and they're young, their teens, their early 20s, they typically have smaller abdomen because the testosterone suppresses that LPL activity. Well, as the testosterone levels go down, okay, now they start making this gut. Okay, so as men age, as well as women, as they age, testosterone decreases, insulin tends to increase, and they tend to develop this gut. Okay, for women, they may store it more in their hips, but they also tend to get a little bit more of that gut as well. Progesterone, okay, another sex hormone. Progesterone actually increases the activity of LPL, especially in the hips and butt. So yes, in women, progesterone is a woman's hormone, is that they tend to store fat in their hips and butt. So we typically try to keep progesterone levels, when I say optimal, we're going to say on the lower end. So if you don't need you don't need progesterone replacement, we try to avoid it because progesterone potentially will make women gain a little more weight. Estradiol can actually decrease LPL activity, so again, that can help with controlling weight. And it's this decrease in the estrogen then. So as women age, okay, they approach menopause, their estrogen levels come way down, so no longer they have this protective effect of the estradiol because the estradiol levels fell way off. So as women go through menopause, estradiol levels go way down and they tend to increase again fat deposition because they lose that LPL suppression from the estrogen. Estrone, on the other hand, that's the one that's made by some of the fat cells, can easily be made in the fatty tissue. So we want to keep estrone levels low. Alright, so sex hormones do affect weight. Okay, so that's the point. And so subsequently, yes, if we optimize sex hormones, it can help with weight control as well. So, hormone balance or hormone imbalance. The symptoms overlap. Lots of different hormones can affect some of the same symptoms. Testosterone, estrogen, but also thyroid. Those are another one, but we just don't give thyroid pellets though. You typically have to take pills for that to optimize that. But symptoms, hormone imbalance can occur in men and women literally at any age, because literally from mid-20s on it certainly can occur. What I would encourage you to do is get tested. Get your lab work tested. Low normal is not optimal. What we want to be is towards the higher end, specifically with kind of the testosterone and potentially with estrogen. You may want to be in the higher end, kind of get in that optimal ranges. Many labs, you may get them done, don't really have age-specific ranges, and we'll also find that a lot of the ranges change depending on lab to lab, and now we're seeing even new ranges for thyroid too. So what I encourage you, get your labs done and let's start going over yours to try to sort some of this out. Now, if we're going to do pellet insertions, it does take a minor procedure. It's done just with a local anesthetic. It only takes a couple of minutes, but the pellets are placed in the subcutaneous tissue of the buttocks. So right in that fatty tissue, almost on the cheek of the buttocks, the outer edge there, you can get some minor bruising, a little swelling, a little soreness. After a pellet insertion, we'd like you to avoid strenuous exercise for the first 4 to 6 days so it really seals in there and heals in there. And generally it's going to last about 3 to 4 months in women, about 4 to 6 months in men. We typically would recheck some blood work on you because we want to check, do we have the dosing right? Okay, in about 4 to 6 weeks after you've had a pellet insertion. Now, switching gears a little bit, if you've had a pellet insertion, what can you notice? And so obviously we want to notice that you're feeling better. And just talk about feeling better, there are kind of two situations that I see. Sometimes about 7 days after having a pellet insertion, all of a sudden there's almost like the light switch, hey, I feel great. Or it may be a very slow thing. And it's hard to predict any one individual. That it's not like any one day you woke up and I just feel wonderful. It's like, hey, over a period of time, over about a month to 2 months, all of a sudden I am feeling a little better, a little better, a little better. Occasionally we see it, some people actually need 2 different insertions, so it may take 2 times to really get to those optimal levels. But some potential problems, I should rephrase that, it's not really common problems with first insertions. People will sometimes note a small amount of fluid retention, which then, okay, yeah, they could gain a couple of pounds. It typically occurs in the first insertion and more common when it's really hot and humid weather. Same thing at the swelling of hands and feet. It's kind of typically that's a little fluid retention. You may notice a little breast tenderness, nipple sensitivity. If you have a uterus and you're through menopause, potentially you could get some uterine spotting. Mood swings, irritability while these start to kick in, but it tends to fade with time. Could you actually extrude the pellet, meaning is it pushed back out where we put it in? Well, that's why we want you to try to avoid really strenuous activity during the first 4 to 6 days or so to prevent that problem. A little bit of facial breakout. Some little infected cysts can occur, generally only with the first one, and it usually has to do with kind of when we significantly change the hormones. Once we get them where we need to be, that tends to fade away, and it's also easily treatable. For men, there will be a little reduction in testicular size, and there will be a reduction in their sperm count. So if you're trying to get pregnant, we'd encourage men not to do a pellet insertion for about 3 months before they're trying to impregnate their partner. So kind of you would have a reduction in sperm. That'll come back very quickly after the pellets wear off there. All right, what are the positive effects? And this is really kind of you're going to feel better. And it's just kind of, sometimes that's just overall how you feel. Well, enhanced erectile ability for men, prostate protection for men, but just enhanced libido for all people, cardiovascular protection, increased bone strength, increased muscle strength, increased mental clarity, lower cholesterol, increased energy, just that feeling of I feel better. Reduce body fat, because increased testosterone increases lean body mass, your metabolism will increase. Depression relief, we see mood swings tend to smooth way over. So what are patients saying? They basically have increased energy levels, restored interest in life, increased sexual drive, consistency in mood, relief from anxiety and depression, increased mental clarity, decreased body fat, and a greater capacity for just getting your body in shape. It's like, okay, I get much more out of my workouts now than I did before. So all of this can be very positive. Now, obviously, it's not just does it work, but okay, how much does it cost? Now, one of the nice things with the Center for Hormone Health and Wellness is that often we can get the labs in the consult potentially paid through insurance. And for labs, typically, even if you're paying for them yourselves, we've driven that price as low as possible. Certainly with insurance, you may have copays, you may have deductibles. That is dependent on your insurance. There's not a way for me to really answer that question, but usually labs and consults potentially can be covered by insurance. The pellets in the procedure typically are not. They're generally not covered by insurance, and the Center for Hormone Health and Wellness does not actually accept insurance itself. Through Center for Weight Loss Success, I can see you as a consultant. But the pellets themselves, and the difference in price there is dependent on if males need much higher doses. So typically there are more pellets that are involved in a certain level. The cost goes up. For females, it's pretty standard, and the pellet sizing then is fairly small, and subsequently then it's a really standard dose there. All right, but if you have questions on that, don't hesitate to ask them. Throw a little cartoon in here. The women telling her doctor, can you give me something to make my hot flashes hotter, hot enough to melt fat, burn calories, and ignite passion? Well, with the pellets, we won't make your hot flashes hotter. We're going to cool them off. But we certainly can help you with melting fat, burning calories, and igniting passion. All right, so what to do now? We're winding this whole thing down. Call today to the office. There's the number, 757-223-0940, and get your labs drawn and set up your consultation to sit down with me. The Center for Hormone Health and Wellness. Again, the phone number, 757-223-0940. The website there is www.centerforhormonehealthandwellness.com. Thank you for listening, and I encourage you, pick up the phone, get the appointment set up for your lab draw, as well as potentially sit down with me and go over your situation and let us help you optimize your hormones to get in the best health possible. Thank you for listening, everyone. We'll see you at the office. Take care.